Hi everybody, Dr. Bryton here for Tooth Tip Tuesday, and today we're going to talk about two new studies that came out. One about diabetes and tooth loss, and the other about dentures and malnutrition. So first things first, with diabetes, it has been somewhat, assumed forever that ultimately diabetes is essentially going to increase your risk for tooth loss. And it makes sense, right? So we know that diabetes increases your risk for gum disease, as well as cavities. And so with it, it only makes logical sense that ultimately tooth loss will come with that. And so a study just came out, is actually done in Iran. It was a cross-section. It looked at a number of different studies and discovered just that. There is definitely a strong association between diabetes and tooth loss, which is, I guess, impactful for people, because for those of you that have diabetes or maybe are pre-diabetic or maybe are predisposed to diabetes, it's something you should really consider is how are you going to take care of yourself to hopefully take care of your whole body health, but also take care of your oral health so that you don't lose teeth. And that's just losing teeth. It's not also the things we talked about in the past, like gum disease. But then from there, I think it's also somewhat telling if we get into the other study that talked about essentially the connection between a denture and malnutrition. And it's something that I've actually talked about with patients for a while. And again, it was kind of assumed, but it was shown in this study that ultimately for people that have dentures or partial dentures, they can't digest their food the same way. And the reason being is digestion of your food, believe it or not, doesn't start in your stomach or your gut. It starts in your mouth. And the process starts by you chewing your food. And if you can't chew it the same way, ultimately you don't get the same nutrition out of the food that you have. And so ultimately, when you have a denture, you have a partial denture, we know that you can't chew and break down food at the beginning of that digestive process to the same degree that you can with natural tooth structure or implants. And as a result, we see now that your nutrition won't be as good as a result of wearing that denture, because you're not digesting it the same way. You don't actually break it down and get all those nutrients out of it. So I think these are good information for patients to be aware of, because I still have patients to this day that come in and they'll say, maybe not diabetics, but just in general, why don't we pull the tooth? And I will talk to them about, well, if you pull the tooth, here's inevitability. You pull the tooth and you don't replace it, we're probably going to end up in a partial denture or a denture at some point in time. And here's how it can affect your systemic health. And just like I tell patients all the time, my goal is to optimize your oral health so as to optimize your systemic health. And it starts right there. So two very telling pieces of research there that I think are helpful for all of you to know. The connection between diabetes and tooth loss. And I think just one more reason that we really need to be preventative and take care of things like diabetes. And then the connection between dentures and ultimately malnutrition, and the lack of your ability to properly compress and break down and break apart and start that digestive process of food, and thus a reduction in the actual nutrition you get. So if you have questions about that, please reach out. It's really interesting stuff for me, and I hope if those of you that have interest in it seek more information, please get a hold of me. So I hope you have a great rest of your Tuesday and a great rest of your week. Have a wonderful Cinco de Mayo. Have a wonderful start to hopefully some sunny weather. But thank you for tuning in. Take care.